Well, Michael, they do complain, but there's one big advantage compared to your patients. We don't have to speak with their parents. So this is the problem that we are faced with all the time now. So I think we all agree that, for example, for this patient who developed osteoarthritis due to an uncorrected cam deformity over a couple of years here, an early correction of this asphericity would probably have been beneficial. But we don't really know if we could have stopped the process of osteoarthritis in this patient. We don't really know when exactly do we have to intervene. We still don't really know if a modern MRI would help us to find this time point. Would a cartilage treatment in this case have changed the result? Maybe there's some evidence that just heard before from Lorenz. And how would such a treatment look like macro and microscopically? So based on those questions, we have proposed a four-year perspective project which was funded by the Swiss National Science Foundation 2 years ago. It's a big project of about 1.2 million Swiss francs, and we specifically assigned this annual project to address these questions. What it basically is, it's a controlled in vivo experimental study in Swiss Alpine sheep. What do we do with this project? We try to induce surgically femoral acetabular impingement, CAM-type impingement. We would like to do some staged surgical correction. We would like to correlate the histological findings with the biochemical MRIs, and we would like to evaluate the effect of chondrodegenerative agents, or at least provide a platform of doing so. So the aim of this talk is to give you an update on the preliminary results, because we are about at mid-time of this period, and this is how it looks like. Why did we choose the hip in sheep model? So the sheep actually has a comparable hip anatomy. Interestingly, it also has some comparable hip biomechanics regarding contact pressure magnitudes and also distributions, and also the mean surface stresses. And regarding radiology, they have some kind of comparable hip cartilage relaxation times. In contrast to the dog, they have no natural predisposition for osteoarthritis. And this is the main factor, we have a time-lapse effect, which means we see a joint degeneration in sheep within months compared to decades in human beings. So it's really a time machine compared to human beings. This is how it looks like, a pelvis from a sheep taken from posterior superior. This is how a proximal femur looks like, a little bit different than the human femur, and Tom Hogarth would call it coxa recta. So it's a natural asphericity that the sheep have in the superior portion of their femur. Now, how can we induce an impingement or a CAM-type impingement? On the left side, we have a more or less normal or spherical human hip. In the mid, you can see a cam or pistol grip deformity, and on the right, you can see a scheme of a sheep hip with this natural asphericity superolateral. And by doing a closed wedge intertrochanteric varus osteotomy, one can induce an impingement of this asphericity here right at the acetabular rim, and we were also able to correct this asphericity to have a round spherical head after correction or after induction of the impingement once again. What kind of surgical approach are we using for doing the osteotomy? So the osteotomy is done strictly extra-articular with a subvasous approach. This is how it looks like in a sheep. It's a little bit a different orientation. And we are correcting the asphericity not through a full surgical hip dislocation, but it's comparable to an anterior approach in human beings. So it's an intermuscular approach that we are using to correct the asphericity in a second stage of the experiments. So this is how sheep walk. Here approximately would be the hip in this region here, and you can see that there is almost only flexion and extension. So it's a very predictable motion that sheep have here. So it's almost flexion, extension. There's almost no rotation or not a lot of rotation, and almost no or very little abduction and adduction. So this is a big advantage, because it gives us some kind of range of motion which is limited, and it's very predictable for us to simulate something. This is how this impingement can be induced. So this is a normal motion of the sheep hip, which usually does not impinge. And if you perform such a varus osteotomy, then we can create in flexion a posterior impingement. So it's in contrast to the human beings, the impingement occurs in the posterior aspect and not in the anterior aspect, but exactly where we would think it would occur, at the site of asphericity of the femoral head, which you can see here at the posterior superior aspect of the acetabulum. So this is the impingement zone from those animations if you look from the top on this ovine femoral head here. This is the aspherical zone, and that's exactly where we have the impingement. And this is how it looks in real time. So that's a sheep hip, and if you start moving this hip, then we can create exactly the same impingement here in the posterior superior edge here of the acetabulum, which looks like a cam impingement. And this is the lesion which is already extensile here in this particular sheep. So we have labral lesions that occur, and if you correct it, then you don't have an impingement anymore. And you're going to see the corresponding acetabulum of this femur after correction, which shows much less damage at the posterior or inferior region here. There is some damage because it was exposed for a certain time, but there is certainly not as much damage as we saw without correction. This is how it looks like on a radiograph. That would be the site of osteotomy on the left side. We have used initially this particular hook plate, which was designed for dogs and which ran out basically, so we had to define a new plate on our own. And this is the offset creation that we can do in those cases, so that you can get a spherical offset once again. They are not compliant, our patients. That's a problem. So this is the first day after surgery. They do full weight bearing right away. This is the left side that we have operated on here, and that's already the first or second day after surgery. So they walk around. They have a kind of restricted range of motion with this suspension device, but they do full weight bearing right away. This is after healing. Again, they do only flexion extension, more or less, and they can either jump and run around. These are the lesions that we can observe. So here is a more static image compared also to what we see with the histological image. So this kind of labral lesion with an associated lesion of the cartilage, which is exactly what we see also with human beings. And we see the same alterations also on the femoral head, at the zone where the asphericity is, some kind of damage of the cartilage, which is osteoarthritis. And there is a time-dependent effect, so the more or the longer you expose the sheep with this pathology, the more damage we found. On the left top side, this is normal acetabulum. After 14 weeks already, we have these alterations of the labrum and the cartilage. Sometimes, or even a little bit later, we see these delaminations that we have already seen before from Lawrence, and we have a full joint degeneration already after 36 weeks. We did some pilot studies. So the first one was a proof of concept. We wanted to compare the actual impingement zone and the virtual impingement zone, whether to see whether that our concept really works. And we had initially some concerns of the vascularity of the ovine femoral head, because this is exactly the zone where in human beings the lateral, the retinacular vessels enter into the femoral head. And we were concerned about AVN in those cases. So we wanted to know exactly how is the vascularity of the ovine femoral head. And of course, if they do full weight bearing right away, we wanted to know how much is the risk of iatrogenic femoral neck fracture after offset creation. This is a study that Corinne Zurmüller did, which is already here. So here you can see the virtual impingement zones, which were posterior, inferior here in this sheep, and the corresponding lesions here. And if you plot them with the clock phase system, then you can see that we have a very nice correlation between the actual damage that we see with the cartilage, with histology, and with just by observation, and with the impingement zone. So we think that this is a proof of concept that it actually impinges, and we can have the lesions exactly there where the impingement occurs. A second pilot study was this vascularity of the ovine femoral head. We did computer tomography scans with IV contrast, some vascular corrosion casting, colored silicone injections, and we also counted the vascular foramina, exactly what we have also for the human femoral head in the last 10 to 15 years too. And what we found were two vessels that were supplying the femoral head. It's also very similar to what we have in the human beings, except that everything is 90 degrees rotated. We found a very constant vascular tree, and we found one from anterior, which comes from the lateral femoral circumflex artery, from the ascending branch, and then it enters the femoral head in the anterior portion. In contrast to the human beings, where typically this would be the branch which goes to the Weidbrecht ligament. This is how it looks like. So this is a view from top. That's the aspherical portion here, and that's this branch. And this is an anterior retinaculum that goes into the epiphysis. And the superior neck is free of vessels. Here again, with the corrosion casting, you can actually see how they enter into the acetabulum. You can see those those vessels if you cut the bone, and here at the superior aspherical portion, there is basically no vascularity. And also the vascular foramina are typically located in the anterior portion. We also found a posterior vessel that supplies the femoral head, which comes from the medial femoral circumflex artery. That's the actual retinaculum, the superior retinaculum of the human hip. And it's also the deep branch, but it doesn't go to the superior portion of the acetabulum. It does go to the posterior aspect of the femoral head. And this is how it looks like if you dislocate the hip. That would be this vessel running into the epiphysis, and again, the aspherical portion is free of vessels. This is how it looks with the corrosion casting, so you can very nicely visualize how they actually enter into the bone, and if you take them off, then you can see those vessels really nicely. Again, the vascular foramina are typically located in this area, not at the location of the asphericity. How about the fracture risk after offset creation? We did a similar study in sheep hip, as was done by Mardones some 15 years ago, I think. So we took some kind of staged offset creation, 3 millimeters, 6 millimeters, and 9 millimeters. This looks really not normal anymore, but we wanted to know where exactly is the risk, or which ones of those corrections really bear a high fracture risk. We put it into a low weight bearing, and we saw that whether there's intact. We had this curve here. If you remove 3 millimeters, you don't lose a lot of your rigidity and your stability of the femoral neck. If you remove 6 millimeters, which looks quite normal here, then you still have a very good stability of the neck. And with 9 millimeters, then it already drops. But we have some information regarding the major force or maximum force of the ovine biomechanics, and if they run, this is the maximum force that they can create. So even if you would do a correction like that, then you are safe regarding neck fracture. And this is the maximal load. So if the maximal load, if they jump up something, then you end up with this force here, and it's still below this maximal correction. So it's pretty safe to do this offset creation, and so far we haven't had a neck fracture yet. We can use this information also for human beings. If you do quantitative CT scans, we can very nicely simulate exactly the location of the fracture site with finite element methods, and we can use this also for human beings. So if you do a quantitative CT scan for human beings, you can use this validated method now to check whether somebody has an increased risk of fracture. So this is really something that was coming out aside from the main project. This is the overview of the main study, which will start soon. We have 5 groups of 10 sheep, where we do a surgical induction of the impingement with the osteotomy and a staged surgical resection. In group 0, we don't do any correction at all. Then we will follow up 5 hips just like that until we have euthanasia at a certain time point after a couple of weeks and months. We can add some potential cartilage therapy. We are going to use PTH in this case because it's easy to apply, and we know that it might have some chondroregenerative effect in those hips, but you can basically use any other type of cartilage therapy too. And we're going to evaluate the outcome based on MRIs. We are using T2 and T-GEMRIC. This is an actual T-GEMRIC index, T-GEMRIC image of one of our sheep, and we will correlate it with histology. So the pilot projects are finished, and the main study, as I said, is about to begin. We are still waiting for a new plate, and we try to standardize the osteotomy by creating an instrument like that, so that you always have the same angle in a very standardized way. So this new instrumentation is something that was just designed some months ago. So in summary, I think the impingement sheep model has the potential to really speed up impingement research. It opens the door for the evaluation of novel MRI techniques in comparison to histology, and I think it can provide a platform for evaluation of cartilage therapies. I think there's more to come in the next 2 years, and I will give you an update at the next HIP Symposium. Thank you very much.